I personally believe it's a very challenging thing to ask a front desk person who's already very, very overwhelmed with all their other administrative stuff that they're doing, and by the way, constantly being interrupted to pick up the phone, to also be tasked with handling the contact forms. I don't think that they should. I actually believe that that should be someone that's a dedicated role. So we have VRs, we call them virtual receptionists, that are fantastic. And it really just comes down to finances, in my view. I mean, is the juice worth the squeeze? Especially if you have more than one location, I don't think there's any doubt whatsoever that you should have a dedicated person. They can be remote, they don't have to be in the practice. We have amazing, full-time VRs that we offer as a service. And that's all they do. They might work with between 1 to 4 locations, and it's one person full-time. And they go through like a very rigorous 6-month training process to understand everything that's going on. And the clinical side, what they can say, what they can't say, that's another big component as well, is kind of the PHI conversation. What can they say, what can they not? It's something that I really truly don't think that the front desk has time to do. On top of that, most front desk folks are not trained on a CRM. And I think you need to be trained on a CRM in order to really understand how to follow up with those leads. And if they don't have a CRM, it's just going to be impossible to follow up with people. And that's what I tell, practices as well. I'm like, there's 2 things. One, even as a marketing guy, I'm the first person to tell you that bringing in existing patients that you already have is going to be way cheaper than spending money on bringing in new patients. That's the first thing. The second thing is, basically, if you have lead gen going on, if you have any kind of lead gen, don't spend money on leads if you don't have an amazing process to capture those leads. It's not worth the money, in my view. There's so many kinds of marketing nowadays that don't require lead gen as well. I'm actually kind of not a fan of lead gen in general. There's so many ads, for example, that will just generate phone calls directly to your practice. That's great. Then your front desk picks it up. They're already trained to do that. Anything that you're introducing, you have to make sure that you have the proper process and SOP at the front desk to handle that lead. That sounds obvious, but most practices, I don't think, understand that. I call it aligning the planets. That's the metaphor that I use. You have to have the right ad at the right time, for the right price, and you get the right intake to support that ad. Otherwise, it's not worth doing. So the easiest way to get a patient back in the door is just frankly to communicate with them. Make sure that you have some sort of active, it could be a newsletter, a re-engagement campaign. There's really good companies out there that specialize in this, where you can basically pay them to, re-engage patients for you. And again, like I said, even as a marketing guy, the cheapest new patient that you can ever bring into your practice is an existing patient in dentistry. And dentistry has that privilege in that sense, that perk, because, that's not necessarily true in other areas of healthcare, but in dentistry, bringing in an existing patient is going to be the cheapest thing that you can ever do. So I'm making sure that you re-engage them, making sure that you just have, some kind of mechanism to communicate with them. Typically, most offices have, some kind of solution where they're following up with them for their hygiene appointment. But even above and beyond that, it's nice to have a newsletter. It's nice to, just have some sort of list of patients that have fallen off your hygiene schedule. And you can see what's going on with them, if they've moved or this and that. I can't tell you how many patients that we've gotten that are, for example, from patients that have fallen off the hygiene schedule, meaning they're no longer coming in from hygiene, but it's for a legitimate reason. They moved from Michigan to Florida. Okay, well, they're not going to come in for hygiene, but their mom is still in town and their mom might need some dentures, and so it's good to keep in touch with people. And one of my biggest tricks is to pay our front desk better than market average. We pay our front desk about 20% over market average because I don't want the great ones to leave. Why? Who's the first and last person that a patient talks to at your practice? It's not the doctor. They see the dentist for 5 seconds. They see the hygienist for the majority of the time. But the very first person they speak to and the very last person they speak to is the front desk. So we like to make sure that they're very overpaid. My favorite thing and way to hire these folks is we've had amazing luck over the years hiring great front desk people from food service, waitresses, bartenders, this kind of thing.
People that are personable and can talk to people.
Yes. I and this might be controversial to say, but I think it's becoming more and more kind of known. I do not care whatsoever almost about someone's credentials or qualifications for front desk or anybody that's, non-clinical, that's patient-facing. I really just care about how do they interact with people? How do they make people feel? Those are such difficult things to teach people. Anybody that's smart, you can teach them the clinical stuff. They'll understand, If they can make a mojito the right way, they can understand dentistry. So I'd rather they have a good sense of understanding how to communicate with people, and then you can fill in the gaps later. So we have two rules. One, everything has to be animated. Everything has to be animated and everything has to be custom. So any piece of content that we're working with clients on has to be custom. Now, I will say, this took us probably like 4 years, to be honest, to figure out and crack this code on how do we do great social media at scale. Ideally, it's always going to involve the office in some capacity. There's a couple workarounds to this. Let's say you have a doctor and the doctor is really, really camera shy. Or they're really introverted, which I understand. I'm sort of an extroverted introvert, right? Like I don't love talking to people, but if I have to, I don't mind it. It's just like, I'm both, right? And I think a lot of doctors feel that way, a lot of clinicians feel that way, or they're just straight up super introverted. And then the ones that are extroverted, you'll know, they they really enjoy it. And so the ones that are extroverted are easy, right? But that's probably, to be honest, less than 15% of the market. I think the majority of the market, or they're just too busy, right? They're just too busy to make content. Making content is not really something that's on their mind. It's not something that they're really focused on. I think that, you nowadays, especially with AI as well, there's so many interesting things that you can do with AI. I just did a talk at the ADSO. We talked about HeyGen. You can literally make a 5-minute video, upload it, and then, basically get AI to make you say anything that you need to say. I think the technology is about a year away from being like really, really, really market ready, but make no mistake, it's coming and it is going to be completely transformative, to say the least. So I think it's important people understand that, kind of see what's coming. But just as an aside, we took about 4 years to really, really perfect how we do social media for dental practices in particular, because it's this mix of being completely original, super creative, super engaging, but also scalable. So we hired ex-Marvel, ex-Disney, and they came in and made incredible, and I just said, look, if you could make anything, sky's the limit. What kind of content are you creating? And they made the best stuff ever. The problem was it was a little bit hard to scale. Sometimes it was a lot of it hard to scale. So we were like, all right, how do we bridge that gap? And I think it's kind of a Venn diagram, like super, super awesome custom created content, but also scalable. So if you can do both of those things, I think you're in a really good spot.
I've seen a couple of dentists absolutely blow up on social media. Maybe on TikTok, they have 1 million views and they're posting some more comedic type content where they're running around, maybe answering some questions, but really just kind of putting on a fun show that's, entertaining to watch. Is that practical? And do you think that leads to new business, or is it just, a fun thing to be able to say, hey, we have 1 million views on TikTok?
Yeah, I think the dentists that are really into making content and really love it, I think it's super practical. If nothing else, if you enjoy doing it, absolutely do it. There's nothing wrong with, I don't think there's any downside whatsoever to making awesome content. I don't think there's any downside to that whatsoever. That being said, again, that is the minority of the minority of dentists. The dentists that love making content, and you know this, it takes a bunch of time. It takes a lot of time. You have to set aside time. Dentists are super busy. They're super, super busy. Everybody in the medical profession is really, really, really busy, and they're tired. Really busy and they're really tired. So the idea of making content and then putting yourself on camera and people can see it and all this other stuff is, let's just say, incredibly unappealing, I think, to the average dentist. And I don't think there's anything wrong with that. One workaround that I really love is hygienists tend to kind of have the opposite personalities. I'm absolutely generalizing here, but I find that to be true. Hygienists typically love explaining what they do. They feel like they don't always get the chance to explain what they do. It's a lot like NPs in the medical profession, right? Nurses know all kinds of stuff, and sometimes they live in the shadow of the doctors. And so I think a lot of hygienists really enjoy high optics stuff. And frankly, again, they're the person that tends to have the most face time with the patients. So having them make content is one of my favorite workarounds as well. We have offices, we have dozens and dozens of offices where the doctor, we might have some photos of the doctor on social media, but it's all about the hygienist, and the hygienists run the show. And then people come in and they recognize the hygienist, or sometimes they want to see certain hygienists. Sometimes you want to get away from that. It might not be good. Again, as a former COO of a DSO, I don't really love that, because then we got to move the schedule around. But I'd rather have patients know who my hygienists are and want to come and see them because they love them than not. So I think it's the juice is worth the squeeze in that case, and I really think that it's good to let hygienists that have that desire to be able to showcase that.